Have you been told that you have cataracts? Or maybe you have floaters that still have been around for many years, but you're still not quite sure what they are. I'm Dr. Thomas Vo. I'm a board-certified ophthalmologist. In today's video, I'm going to be teaching you basic eye anatomy so that the next time you go to the eye doctor, you'll know what they mean exactly when they say that your cataracts are getting a little bit worse. Let's get started. Okay, I've got a model here. This is a model of the right eye. There are 6 muscles that attach directly to the eye. You have the superior rectus, which will let your eye move up. The inferior rectus will let your eye move down. The medial rectus sits closer towards your nose. That's going to pull your eye towards your nose. The lateral rectus will pull your eye outwards. And then you have 2 oblique muscles, the superior oblique and the inferior oblique. These are primarily responsible for torsional movements of your eye. Just to note, I'm not going to go into too much detail about it, but aside from the medial rectus and the lateral rectus, all the other muscles have both secondary and tertiary movements. The white part of your eye, this is just called the sclera. And then here in the center of your eye, even though you're looking directly at the eye color, there's a clear layer that sits on top anterior to the iris. And this is called the cornea. It's an important structure because it's very important for the total refractive power of your eye, meaning that its main role is to focus light into your eye to help you see. And if you're ever thinking about having either LASIK or any sort of laser-based refractive procedure, what they're doing is using the laser to reshape the cornea. So moving into the eye. So again, like I mentioned earlier, the colored part of your eye, this is called the iris. The iris controls the size of your pupil. And just behind the iris is the lens. And this lens is very important. We're all born with it. When we're young, it's nice and clear, but as we get older, this is what eventually becomes the cataract. And so during cataract surgery, what they'll do is remove the lens and then implant an artificial lens inside your eye. Just behind the iris, this area here, this is called the ciliary body. It plays 2 important roles. 1, it produces aqueous humor, which is important to maintain eye pressure. And then 2, it actually alters and controls the shape of the lens inside your eye. This is through a process called accommodation. This allows you to focus on objects that are close and then far. The next structure I want to point out, this is called the vitreous. It kind of fills the entire cavity of your eye. One thing to note though is that it's actually a jelly-like structure, so it's actually very soft in reality. And it's important because people who have floaters, it's because of degenerative changes that happen and occur within the vitreous, and you're seeing the shadows of that being casted onto your retina. Lining the entire inside of your eye is called the retina. This is a thin layer of tissue. It has all the photoreceptors, and so it's responsible for capturing light and then sending that signal to your brain, so that's how you're able to see images. The area that has the most amount of photoreceptors is called the macula, and within the center of the macula is called the fovea, and that's this area here, demarcated by the yellow. When the retina captures light, it processes it into a signal, and then the signal is sent to the optic nerve, which is this structure here. The optic nerve basically connects your eye to your brain, so you can kind of think of it as like a data cable. And so when the light enters your eye, hits the retina, all this information is sent through the optic nerve to your brain, and that's how you're able to see. The one thing to note, though, is that the optic nerve, where it inserts into your eye, actually serves as a blind spot. And so we all have a blind spot. It's part of our normal anatomy. And so the light pathway, when light enters your eye, basically first it will pass through the cornea. It will go through the pupil. It will pass through the lens. From the lens, it will hit your retina. And then from the retina, that information will be processed and then sent through the optic nerve. And that will eventually go back to your brain, and then you're able to see images from that. And so that's just the basic anatomy of the eye. In future videos, I'll probably go into more detail about the different structures and what they do exactly. If you found this video helpful, please make sure to like and subscribe, and then also just drop a comment down below if there are certain topics that you'd like me to discuss in future videos. And that's all I have for today. Take care. Bye.